Hello, good day everyone. First thing first, I want to introduce myself. My name is Prima Yudhistira. I'm the representative from Group 2, and today we want to show you the result about our group discussions about this lockdown policy around the world. Me and Annette will show you our group discussions in this video. And as we all know that COVID-19, or we called it as coronavirus, already have spread around the world and it has killed many people around there. And many countries have taken steps to prevent the spreadness of the coronavirus. And one of the way to stop the spreading of the coronavirus is the lockdown policy. And today we will discuss it and we will show you about our group discussion about the lockdown policy itself.
Okay, so before we jump to the main topic, first let me introduce my group members. My group members are, the first one is me, Prima Yahya, and then Anet Fabiola, Kasih Hafiz, and Agung Perwira. So the first one is what's actually COVID-19 and the lockdown policy itself.
So in here, I want to explain about the COVID-19 and pros and cons in applying lockdown policies. What is COVID-19? COVID-19, or coronavirus disease 19, is a virus that interferes with the respiratory system and was first discovered in the city of Wuhan, China at the end of December 2019. This virus spread quickly and has spread to other regions in China and to several countries, including Indonesia. This makes several countries about implement a policy for lockdown in order to prevent the spread of coronavirus. Coronavirus is a collection of viruses that can infect the respiratory system or pneumonia, even to death. In many cases, the symptoms of this virus are flu and fever. In order to prevent the spread of COVID-19, several countries around the world have implemented a lockdown policy where people cannot go out or enter the country in order to prevent the spread of COVID-19. But there are some pros and cons in implementing this policy. So for the pros is health problems. So lockdown can reduce the risk of spreading the virus. In the second, better environment. Lockdown can decreasing pollution. And the third, more safety. There is no direct contact with people or social distancing. This cuts the spread of COVID-19 virus. And for the contra of lockdown policies are economic problems. There is recession, decreasing economic activity, and will cause an economic crisis throughout the world. In the second, important event has been cancelled. Many important events such as Football League, Euros Cup, events in government, etc., it has been cancelled because of the pandemic. And the third, increasing unemployment. Many employees get fired because the company didn't have money to pay employees. Even in Indonesia, it was felt the layoff of employees.
So this lockdown policy have implemented in some other countries around the world, especially in Europe. And in this time, we want to compare the countries that have implemented this lockdown policy until this now. Is it work or it is failed? It is effective or it is not effective to cut the spreadness of the virus. So we want to compare 3 countries that have implemented this lockdown policy. This first one is Italy, and then Spain and India. Okay, so the first one is Italy. We can see in here in the data that took from the latest data about COVID-19 in Italy. The number of the deaths from COVID-19 in Italy is now 21,067 people, and the coronavirus cases in Italy now is 162,488, and then the number of people recovered from COVID-19 in Italy now 37,130. And then we can see that while millions of Italians have been staying at home since 9th of March, when the Prime Minister, it is Giuseppe Conte, imposed a national quarantine. It means that this country, Italy, have started the lockdown policy on 9 March. So in here we can see the data. After the 9th of March, we can see that in the 20th of March, it is the top of the new cases of the coronavirus infected in Italy. But from the April 12th, we can see that it is some progress in there. The new cases is not high enough. It is always go down and go down, but sometimes it go up, but it is rather go down than go up. And I think that this lockdown is quite effective enough, but we should know too that this lockdown policy is not bring in the positive side, but it is bring in the negative side too. For example, we can take a look at the business in Italy, for example, fashion or maybe the food that are very famous from Italy, and it is quite impacted on the economic side of Italy because it's decreasing the economic activity. And then also the Serie A, the football league in Italy, it's have been shut down. The club didn't have the profit, so they have to fire their staff or maybe cut the salary of their staff, the players, and something like that. The next one is Spain. We can see in here the number of the tests from COVID-19 in Spain is now 18,056 people. And then the coronavirus cases in Spain now, the latest now is 172,541. And then the number of people recovered from COVID-19 in Spain is now 67,504. And then we can see that Spain's quarantine, which began on March 14th, will now last at least 45 days until at least April 25. And we can see in here in the data that from the March 14th, the new cases in Spain is always going up. We don't know too what is the main problem that causing this, but it is have many factors. For example, the people is not obey the government regulation in here to stay at home and quarantine themselves. And maybe that in the last 1 week that it is going down, but I think that the people maybe have obeyed the rules and they stay at home, and the spread of the virus they can slow it down. And the last one is India. And then we can see again in here the number of the deaths from COVID-19 in India is now 368. The coronavirus cases in India now 10,941. The number of people recovered from COVID-19 in India now 1,295. On March 24, the Prime Minister of India announced that starting from the midnight, the entire country was going to be effectively curfewed to slow the spread of COVID-19. So, what I think from this lockdown policy on India is quite interesting and it's quite shocking because we can see in here the number of the deaths is not quite high enough. The number of recovered is high too, but the cases is quite high. But I think that we can realize that it is a reasonable action from the Minister of the India, because we can see that India is having a big amount of people in there, population in there, so maybe the Prime Minister think that it is better for them to stop the virus before it's getting worse. And we can see in here the new cases in India after 24 March that have been locked down. It is quite interesting and shocking too, because the new cases is going up, and it is drastically going up until this time now. And I think that until now the lockdown policy in India is not effective enough, because the new cases in India always going up and it is drastically going up. And then, so what about our country? Is it necessary for Indonesia to do lockdown? We can see first from the data, the coronavirus cases in Indonesia is 4,839. The death is 459. The recovered people is 426. And then we can see the daily new cases in the Indonesia. We haven't yet do the lockdown policy, but the President of Indonesia, Mr. Joko Widodo, said that we have to do the social distancing, we have to work from home, and we have to do the physical distancing. And then from the results is we can see the new cases in Indonesia for the coronavirus is a little bit going up, but sometimes it's going down too. But the main thing in here is it really necessary for Indonesia to do the lockdown? Before that, we have to look at every possible policy or strategy to stop this coronavirus. We have to look at which one strategy is bringing the best positive things for Indonesia. And then we have to see from the economic first. Indonesia now, before the lockdown, is having big recession because of this corona. Imagine how if Indonesia do the lockdown, what is the impact? And then the people readiness, the government readiness. If we have to do the lockdown, we have to stay at home, and government have to give us the facilities, for example food and etc. for us to stay at home. Is it a good idea or it is a good strategy for us? And I think that for now it is still in consider, but I think that it's not really necessary for Indonesia. Now with the social distancing or physical distancing, it is quite effective to slow down this spreadness of the corona. If we see from the businessman perspective in Indonesia, it's not profitable for them because it will cut their profit and they can't run their business, and then the economic activities isn't there. And our group discussion results in Indonesia is very necessary to do the lockdown, because from the social distancing it shows that it is quite effective, and for now the number of the recovered people is always increasing, and maybe the case is slower down a little bit, and the key is we have to stay at home, quarantine ourselves to cut this spread of the virus.
Okay everyone, that's all from our group, and I want to say sorry if there are some mistakes that I've made or my group's made, and thank you very much for your attention and your time, and hope you all stay safe and stay healthy at home. Thank you.